Patrick, how you doing, bud?
Not too bad at all, buddy. So, what have you for me today?
Well, we've been talking about drains on all different kinds of governments from all different sources. And one of the big one is healthcare. So we have a couple of videos, one from Jillian Michael and the other one from DeFranco. And I think it's going to outline some of the issues with dystopian futures and who's supposed to get access to this and who's not supposed to, and where some of
Yes.
the big fraud things are stemming from, right? It's an access issue for the most part, where the laws become vague and things aren't clearly delineated, or one law subrogates another law to say that part of that one is no longer effective. But Ms. Jillian Michael and Mr. Philip DeFranco will run us through those processes so we can get more of an idea of what that's about. It's super important if you want to understand how healthcare things are going in the United States and why it is we're losing so much in money. But it's a model that's being abused all over the G20 countries, like ways to just pull the money out of the government. And a lot of it is done by bad faith actors, right? Any
Mm.
kind of white collar crime like this is functionally going to have some kind of a head, but there's also fraud and waste in the system as well, and it's being taken advantage of.
Yeah, there seems to be very little oversight. We're looking there in California, for instance, when it came to the hospice care and so on. There's so little oversight. No checks and balances whatsoever in place.
RFK Jr.'s done some good things. He's done a couple of things I don't understand. But one of the things he just did the other day was he shut down 500 hospices in the state of California. Not one single call was received by a patient saying that their healthcare had been mismanaged. There's been no whistleblower. There's been nobody who said, hey, Nana's healthcare went down and we really need to get her back into hospice like right now. Like that didn't happen, which means it looks like those closings were pretty legit. And if you understand that a huge portion of federal money goes to LA County specifically, a county with approximately 12 to 13 million residents, it means that there is a very, very something rotten to the core going on in that space. And again, we saw Adam Yamaguchi and Nick Shirley going in there and finding a lot of these hospices that did not seem quite legit. And we can put
No,
links to that
not
stuff too.
well. Let's call them what they were. They were just money mills.
Yeah, there were scams. When you see G-Wagons and all kinds of high-end vehicles and all that kind of stuff behind a building that used to be a hotel or inside their parking space, yeah, that's indicative of a bigger problem. But we'll let Jillian Michaels discuss the changes in the laws that have caused some of these major issues. So here we go.
Yes.
Qualified aliens are eligible to receive federal public benefits. The law was explicit. It named exactly who qualified and exactly who did not.
Right. So it was clearly delineated which entities were to receive state or federal funding for healthcare. Right. Very specific, like this group can and this group can't, and she'll go over that. But
Very strict rules in place.
clearly delineated. There wasn't a question on who does and who doesn't. Right. And that was in
Right.
1996 when that was established so that we could help control the outflow of money from the federal government. Now, understand that the states submit from whatever state they're in. They have a Medicare sub program that administrates it for the federal government. They send in the invoices and then the federal government sends the check. But without enough oversight, there's a problem, right? So it means that the moles can get in the system and then funnel the money, right? So that's not good at all,
No.
obviously. And again, like you were saying before,
crazy how easy it was for them to even get licenses to do this.
right? They didn't have
Crazy.
to be medical in any way, but they did have to get signatures from doctors and doctors' offices, which made some of them complicit in in alleged hospice fraud. It's alleged at this point. Alleged. We have to use the word allegedly, even though it's on the balance sheet and it shows bad behavior, right? If you understand that
Yes.
each individual costs the federal government $6,000 per month to be on hospice care, right? And we did the math earlier. If
Yeah.
all of them had just one client, right? The 87 in literally one building cost the federal government $3.6 billion, right? And
Yes.
and that's horrible, right? That's not good. That's bad math. I think my math is slightly off there, but it was a pretty massive number. At its base,
It was wildly crazy number. It's
right. Well, and then the people who are going on hospice, which is a process that takes weeks, not years, and they still had people on hospice after years. It's not how that works.
Yes.
Or they miraculously recovered at like a rate of 90%.
Yeah, that happened actually quite a lot. Actually, Nick Shirley was showing that part. A lot of them just literally just got better, just miracles.
Yeah, you know what? Praise Jesus, hallelujah, apparently. So here we go.
And it categorically excluded undocumented immigrants. Now, that has never changed, actually, so stick with me here. There was no ambiguity, there was no gray area, and for 14 years, both parties understood what it meant because the language left no room for interpretation. Now,
so that was from 1996 to 2010 until ACA came in, called Obamacare, and I think she'll go over that.
Under the original law, qualified meant lawful permanent residents, refugees, people who were granted asylum, conditional entrants, and people granted parole by the U.S. government.
And that's based on an 1898 Supreme Court decision in the Won Kim Ark case that went up to the Supreme Court and designated certain kinds of people who could become birthright citizens. It was those who are lawfully residing within the United States, H-1B visa or whatever it is, asylees that are vetted, those who come to appropriate ports of entry. Very, very clear. And most of it seemed to be linked to that method of citizenship or possible citizenship. That's what that looks like that was linked to.
So very, very, very strict rules in place.
100%.
Overall.
These are the people who can, and these are the people who cannot.
Right.
But then
to make that very clear to people that there's a clear set of rules that operated perfectly well for years.
14 of them, 1996 until the Affordable Care Act. Yeah.
Everybody else, DACA recipients, pending asylum seekers, holders of humanitarian visas, people with temporary protected status, like the Somalians in Minneapolis, they all got nothing. Zip up.
So the TPS thing is a 6-month thing that the Secretary of Homeland Security can say, you get temporary protected status. There was an earthquake. There was some kind of natural disaster. Y'all can come into the United States, and then we will domicile you for a period of time, and then you'll go back. Except that all of the sitting DHS and the appropriate agency prior would just extend that time frame.
Right. Okay.
Oh, not zero. Okay. And even the qualified immigrants, they had to wait 5 years before accessing most federal benefits, with some very limited exceptions for refugees, asylees, and non-citizen veterans who had served in the U.S. military. That was the hard line as drawn in 1996. And as I said, for 14 years that held. Now, in 2010, Barack Obama signed the ACA, or otherwise known as Obamacare, otherwise known as the Affordable Care Act.
I'm going to actually read through this a little bit. So March 23rd, 2010, Obama signed the Affordable Care Act. You are one of the millions of Americans who gets health insurance through work or through a program like Medicare. You are benefiting from the rights and consumer protections. This law is making sure consumers and their doctors, not insurance companies, are in charge. The problem with that is the insurance companies have captured most of the logistics and processing of the insurance, of the pharmaceutical side of it, of clinics, of care, of hospitals, all of that, right? So when this went into place, there wasn't quite that much of a hammerlock on that. There wasn't quite as much of a monopoly, right? Then it says, if you are uninsured or struggling to find affordable health care insurance or health insurance, the healthcare law brings you options to get covered. The health insurance marketplace in every state offers consumers a choice of private health plans. If you don't have health insurance, you can qualify for financial help to lower the cost of premiums in the marketplace. Many Americans can get a plan for less than $100 a month. That's good if you're a citizen, but the problem is you can't have unmitigated immigration and a welfare state. It means that those who are constituents and citizens are paying for people from other countries who at that point are functionally economic migrants, and it's just a dinner bell for healthcare. Everybody's going to come in because they're going to get the free healthcare, right? Which means that system, when you have that unmitigated immigration as well as welfare state.
But it says here that it helps you pay for your health insurance.
Right, except in places like California, you can get $0 per month healthcare, and it is better than most of the healthcare you can get on the private market, right? But that means that a constituent of the state is paying not only state income tax in California and other states, but they're paying a federal income tax, right? And when you include the state tax from California along with the federal income tax, a lot of Californians are paying over 50% of their income into taxes. Also understand that all healthcare that's paid for in the United States, 86 cents to the dollar roughly, is paid from the federal government to the entity. It means that the insurance company is funneling taxes directly into their boards. That's what that looks like.
Because I know there's a Senate investigation into the health insurance companies again, by the way, but It's probably going nowhere, but I know they're looking into it in the United
Well,
States.
it's the insurance companies that are kind of the culprits here. They're kind of the bad guys.
Yes.
Little bit.
Well,
Allegedly.
yeah.
Hold on.
Allegedly.
Allegedly, yes, allegedly. So, here we go.
To understand what it did, you need to understand what it added. So Medicaid had existed since 1965. It's the government's free health insurance program for low-income Americans and the qualified immigrants that I just listed. It's funded jointly by the federal government and the states, and it has strict income limits, strict eligibility rules, and if you qualify, you pay nothing or close to nothing for coverage. If you don't qualify, you get nothing. Now, before 2010, that was essentially the only option for people who couldn't afford private insurance, Medicaid or nothing. Now, the ACA created a second option that had never existed before, the marketplace. And this is a federally run exchange where people who don't get insurance through an employer can shop for private health insurance plans, and for people whose income falls between $16,000 and $63,000 a year, the federal government pays a subsidy directly to the insurance company on their behalf, reducing or in some cases eliminating their monthly premium entirely.
So did you hear that? The federal government pays the insurance companies directly. The way they pay the insurance company directly is with tax dollars, right? So there's no block in the system. What it did is it opened up the floodgates for the insurance companies to get money directly from the federal government.
And obviously, insurance companies, being companies, will do it for profit.
Which they have to do, which means that standards of care and getting approved for certain kind of procedures or getting certain kinds of medications gets severely restricted, because you're going to do it on what is best based on schedule and based on money in a lot of instances. And if I can give someone a very, very expensive medication that the federal government's going to pay for, then it will get paid for and I will get the money, right? Like there's no block there at all. And then people are not getting...
Plus, they have jacked up the prices of a lot of the drugs as well, just to kind of milk both ends, as they would say.
Right. I went to the emergency room in 2021, I believe it was, and I got the bill for $14,000 or $15,000. I was there for maybe 3-4 hours, and my insurance at the time paid all of it except the $100 that I had to pay as the... What is that called when you pay that? The premium, not the premium.
Copay.
A copay, yeah. Oh man, English is hard. So yeah, so I paid $100 copay, but I looked at it. It was like scalpel and cleaning of scalpels and the medication that I got. Right, I got
basically. It sounds like everyone is milking the system. So
yeah, I got 2 pills, a shot, and a cut, and it was 15 grand. Yeah. Like that's insane. That's insane. So, and there's also other weird limits they do. Like certain kind of insurance companies can tell a hospital, you can only charge X amount of dollars for this. We're not going to pay you any more, and you cannot charge more than that. Wow. Yeah, very strange. Like a procedure, let's say a procedure costs 10 grand.
Crazy.
My insurance company says you're only charging them 8 grand, and we're going to go ahead and pay 7,900 of it, and the copay upon Mr. Johansson will be $100. Done.
But it's absolutely sounds like it. Everyone has their hand in the cookie jar.
Oh, they do. They do. Some brown envelopes went back and forth, I'm pretty sure.
Oh, I said big time, big time.
So the lower your income, the more the government covers. Now, this is where things get, we'll say, muddy. When a Democrat-led Congress wrote the ACA, it extended marketplace subsidy eligibility to immigrants who were locked out of Medicaid by the 5-year waiting period. They had a very precise legal tool available to do this: qualified alien. They could have written qualified alien into the law, a term that was already defined in the 1996 law that covered exactly that population. But they didn't use it. Instead, they wrote lawfully present. Now, that phrase didn't exist as a defined term anywhere in federal immigration law. And what it did was it left an entirely undefined description in the statute, handing the power to define it to executive branch regulators. That would be the Department of Health and Human Services, and more specifically CMS. It's Centers for Medicare and Medicaid, okay? And they're the ones who write the rules governing who qualifies for Medicaid and AA marketplace plans.
Right, so lawfully present can be the H-1B visa. It can be all different kinds of things that aren't within those categories that she specifically listed before, which meant it opened up as a Pandora's box. Now there's a virtual cornucopia of all kinds of healthcare that people who couldn't get it before could get it. Again, the dinner bell for healthcare is rung, and they're coming. They're coming. At the time, Obama was considered the deporter in chief. He got rid of a lot of people, a lot more than Trump has, right? But since then, the Democrat position has changed to we need to do something about our birth rate problem and lots of other kinds of things.
So this is malleable. Then the Department of Homeland Security determines and administers immigration status categories. In other words, are you DACA? Are you TPS? Are you a refugee? So both agencies, as I said, are malleable. They are controlled by whoever sits in the White House. Their leadership is appointed by the president and serves at the president's pleasure. So whether the term legally present was sloppy drafting or deliberate ambiguity, it's a matter of debate. But what's not debatable is what happened next. The undefined phrase became an open invitation, and the Democrat-led administrations that followed didn't hesitate to accept it. So from 2010 onward, under the Obama administration, CMS began quietly expanding what lawfully present meant, and each expansion moved in.
So you talked before about bad laws and vague language a lot, right? If you have vague language, you get bad results, right? This is a huge, huge, like, core language issue and vague term problem that was exploited, right? By whom I don't care who exploited it.
The problem was, it was badly written, and secondly, as she was saying there, you can turn it into whatever you want to suit your policy at the time.
Right, you can twig it. Also, because they're in charge of the Plum Book. Have I told you about the Plum Book?
Oh, yeah.
Okay. So the Plum Book is a book that indicates who is at the top of each agency, but understand that the chief deputy in there is someone who has worked up through the ranks. So even if an individual, per the Plum Book, is put in as an executive of a 3-letter agency or an agency that the executive branch has control of, a lot of the people who are in senior leadership in those spaces have a bias. They lean one way or the other, right? Again, with a two-party system, we're going to run into this, right? And we've talked about that a lot before. But what happens is that the chief director or the chief deputy director and those in those high-end positions have a way they're going to run the business of whatever the agency is, pretty much regardless of what the chief of that agency wants done, right? So that's a problem as well, right? And again, the executive appoints them, but the executive can also remove them because they work directly for the Article 2 executive branch, regardless of who's in charge of the administration, right? So that can lead to, again, very bad results.
Another population from the gets nothing column, a potentially eligible column. So first, this only applied to the ACA marketplace, but eventually it bled into Medicaid itself. States and federal agencies began asking, well, if somebody's lawfully present for ACA, aren't they also lawfully present for Medicaid purposes?
And then they become able to access lots and lots of other things. And in a lot of sanctuary states, you do not need an ID to get a state driver's license or state ID. So once they get that state ID, then they are available for all kinds of federal programs. Section 8 for housing, Medicare overall, Medi-Cal, say in California, SNAP benefits, EBT, which is what SNAP used to be. Before that, it was food stamps, right? So all these programs, they get access to all these programs. So it just balloons up quickly because once they can get the lawfully present, they can get an ID. Once they get an ID, they can sometimes even get a social security number. Once they get a social security number, they're in the system and they can continue from that point to just extract resources.
We have exactly the same issue here in Ireland. The minute they get social security number over there, but PPS number over here, once they get a tax number here, they can access all the social benefits to go with that number.
Right. They're like vampires. They're like vampires on the neck of society. They just dig in, right? They're like ticks, right? Yeah, it's not great. And it continues to be a problem.
Yeah. By the way, not just in the US or in Ireland, but all across the G20 countries.
Right. And we have this suicidal empathy for some reason where we decide we have to do this for the betterment of people, but we're ending up with economic migrants that don't want to assimilate into our societies. Right. It's going sideways, and it's going sideways quick, and it's costing the people who lived in that culture and are paying taxes and are constituents in these jurisdictions. It's like in the UK. They're like, we don't want this. And the Tories are like, we're going to give it to you anyway. And they're like, but we told you we didn't want it. It just cycle. Those who are in charge, again, maybe it's a brown envelope. I don't know what it is, but it's not going well. But this vague language is going to cause issues. So
under Obama, CMS began validating broader and broader interpretations. Well, then, May 2024, the Biden administration stretched it as far as it has ever gone. You're shocked. I'm sure you're shocked. Biden's HHS and CMS published a final rule that explicitly extended lawfully present status to people who had been categorically excluded since 1996. DACA recipients, which is one thing, but also, this is key, pay attention, pending asylum seekers. And that's a big deal because here's what Biden's rule changed in practice, okay? If somebody crosses the border illegally, files an asylum claim as a defense against deportation, and then is released back into the country, their immigration status shifts overnight from illegal alien to asylum seeker with a pending claim. That single reclassification, triggered by nothing more than paperwork, makes them potentially eligible for federally subsidized health care.
And lots of other federally subsidized things, as we discussed before, right?
Yes.
So
it opens up a raft of benefits. Absolute raft of benefits.
Right.
And it's the same exactly in my own country at the moment.
Not when a judge approves their case, the moment they file, the healthcare kicks in immediately. They just chill and they wait for a court date to have their asylum case adjudicated.
Which is going to be sometimes 5, 6, 7 years because they end up going to the 8 USC Immigration Court, which is an extension of the executive branch. If they get a final deportation order there, they can appeal it to the appeals court for the magistrates in the 8 USC Immigration Court, at which point, if they appeal it again, it's supposed to go to the district appellate court. It's not supposed to go to a federal district court judge. The Article 1 legislative branch took that from them many years ago.
Wow.
So the thing is, we're having federal district court judges who are nabbing up like these habeas cases that they shouldn't because they don't have jurisdictions, and then they're making rulings. Then the appellate court has to go and then reverse the district court's opinion as written, say it doesn't fall under the APA, and then they have to decide if the final deportation order is good. But again, that's a en banc appellate court, federal district court decision. That is a lengthy process, and it's individual case. And when you have millions of cases, it's just not going to be fast. But now, in waiting for functionally what's going to be a district court en banc panel, it's 5, 6, 10 years. Like it is forever. And that whole time they're extracting resources from the system, right?
Wow.
Yeah, we call that not good. In
No,
polite
it's not.
terms, that's not the best. Could be better.
Yeah,
Needs
some more than
improvement.
10 are using YouTube, as I would say.
It looks like a kindergartner's report card. Doesn't know how to tie shoes. Has great potential. Poor in practice. Whatever. It's just not great.
No, yeah.
Adjudicated in 7 to 10 years. Not hyperbole. There are over 1.4 million asylum cases that are currently pending in U.S. immigration courts. The system resolves roughly 7% of that backlog per year, with new cases continuing to pile on. So for 7 to 10 years, while that individual's case sits untouched in a backlog system, American taxpayers are funding their healthcare coverage. And at the end of that wait, the majority of asylum claims are denied. They were never supposed to be here. They were never supposed to qualify, but they qualified in the interim, and you paid for every year of it. The 1996 law drew a hard line, okay? The 2010 ACA left a phrase undefined, and the Biden administration used that phrase to move an entire population from one side of the line to another. Now,
and their needs are high. And because their needs are high, and the insurance company can get the money directly paid to them from the federal government because there's no break.
Wow.
Right? So you see the issue, right?
I do see the issue. It's the same issue across all G20 at the moment. It's actually the same issue.
Yeah, so it's not great, right? But again, when you take ambiguous language and then you stack a house on it, your concrete base is gone. That thing's just going to fall into the ground. And in California, we have earthquakes.
As I've always said to you, when you write bad or flowery laws like this, they're definitely open to abuse on both sides of the aisle.
Oh, for sure, 100%. Not great.
In July 2025, congressional Republicans and President Trump passed the One Big Beautiful Bill Act. And Section 71109 is their solve for everything that I just described to you. It's a direct attempt to reverse the Biden-era expansions and restrict eligibility back toward the original 1996 framework. Beginning this year, October 1st, 2026, both federal Medicaid matching payments and subsidized ACA marketplace coverage are restricted to U.S. citizens, lawful permanent residents, Cuban and Haitian entrants under a specific 1980 law, and COFA migrants who are citizens of 3 Pacific Island nations with the legal right to live in the United States under a long-standing military treaty. Refugees, asylees, DACA recipients, and temporary protected status holders lose eligibility entirely effective January 1st, 2027.
So we've entered into a state of suicidal empathy when somebody has been here for a long time, even illegally, and they've set up families and they're in the process of being in the United States because they weren't able to process them, right? So there's a legitimacy in time when they're here, but it is still illegitimate. If you are undocumented, if you are an illegal alien, you are an illegal alien. You should not have access to those resources, right? And in October, there's going to be a lot of problems. And I think we're ramping up to some of those issues now in some of the more liberal states and then those on the conservative side as well. Because like you told me many times, there are jobs y'all won't do. You just won't do them. And then once you lose those resources, there's going to be some issues, right?
Yeah, that's going to, as I say, it's going to be very interesting to see how that will affect the economy going forward.
Right. But positionally, it looks like slavery, right? Because I can hire H-1B visa workers for a much lower rate than I can hire literally anybody else. So I'm going to lean into that, but it's just, there's going to be bad outcomes with that because we've allowed it to go on for so long unrestricted since 2010, because we've got a massive amount of illegal immigration. And Obama did the best he could. He deported a lot of people. Again, he was the deporter in chief for any country south of our border, right? So there we go.
And the One Big Beautiful Bill will also close the 90-day self-attestation window that I told you about earlier. So under the new law, verification must occur before coverage begins. No coverage unless you're verified. The loophole closed. All right, guys.
So that was super, super important. So anyway, we're going to flip over to the Philip DeFranco thing. Jillian Michaels, I think, did a really good job there covering that.
She did actually very, as I was saying, she did a fantastic job summing up all the key points for people.
Right, and that's why we picked the video specifically. But go ahead and hold on here for just a quick second. We're going to pull up the Philip DeFranco clip, and he's going to give us some more insight into the issues and the problems. Here we go.
It feels like every day on the show, we're talking about the fate of American democracy, the possibility of World War III, the rise of the global tech oligarchy shaping our dystopian future. You know, the light stuff, the little things, but also, you know, life on this planet and in this country. It was still plenty fucked up when we were spending more time talking about internet drama. And one place that is long and continues to be the case is the U.S. healthcare system. And that's actually something we've seen John Ossoff, one of my Democratic senators from Georgia, really honing in on.
If the Trump administration wants to take the position that they're going to defend the insurance industry, then I think they'll pay a heavy cost at the ballot box.
Right, and last
that's 100%. Because healthcare is a huge concern in the United States. That's a big one. It's a big one.
Yeah, and I think the Democratic Senator, I think he was right there. If Trump tries to defend the insurance companies in any shape, form, or fashion, it would absolutely cost in the midterms.
In the first segment, we talked about claims and delaying medically necessary healthcare, stuff like that. So it seems like the insurance companies are optimizing for profit, which is a very, very indifferent way to run your healthcare system, right?
Yes.
Right, because if it's
very damaging way to run your healthcare system for the patients, by the way.
Right, and that means the overall health of your society is going to go down. So Senator Ossoff is hopefully doing a good thing in calling these insurance companies to the carpet and saying, hey, bud, like, no, like you don't.
Week, he announced that he'd be investigating insurance companies denying claims and delaying medically necessary health care, writing a letter asking for answers from Mehmet Oz, right? Dr. Oz, the former talk show host, failed politician, and now current administrator for the Centers for Medicare and Medicaid Services. With Ossoff saying the improper use of prior authorization where patients must seek approval from their insurance company before receiving care has led to Georgians being denied life-saving medication and others who have been forced to wait months to get the care they need, all at the whim of insurance companies. And he then went on to say, challenges navigating prior authorization practices are not unique to Georgia.
No, they're all over the country. So everywhere you go, you're running into this. And it seems like those who are on the Medicare program at the state level are getting lots of kinds of care and things that may or may not be necessary, but those who are paying for their insurance are not getting medically necessary procedures, and they're not getting life-saving care that they need. And they develop all kinds of other issues on top of that when we could have just nipped the thing in the bud in the way back. But we decide we're just going to deny. And then eventually we're going to get to a place where us administering whatever procedure is then worth the money to do it to the insurance company, also subrogated by the federal government, which is.
And do you think if America, I know it's a strange idea, nationalized their healthcare system, say like what the model they have in the UK, for example, would you think that would happen? Or do you think Americans would go for something like that?
Not the Americans, if they want it or don't want it, it's the insurance company. It's a 1/10 of 1% sitting on those boards that control the flow.
So they would, any kind of nationalized idea would be shot down straight away.
So I, as a citizen, don't have a lobby, but the insurance companies have lobbies. And what you'll see is in the top end of our executives, and a lot of those that come out of the plum book and those who are chief assistant chiefs or chief deputies, stuff like that, they go back and forth from the private sector, back to the government sector, back to the private sector, right? So they get a big paycheck from private industry, they go back into government, have a baseline pay, and then they go back into the private sector, right? They're just handing these people off back and forth, right? So the people who know the regulations, they know all the loopholes, they know how to get through the processes and get the thing they want done because they worked intimately with that government agency, are then passed off to private industry to attempt to orchestrate what is financially in the best interest of the board of that company, insurance company, and other medical type companies, right? So it's pretty corrupt. Like there isn't a restriction from going from a government agency, some three-letter agency, to whatever the private sector equivalent is that is attempting to get through those regulations to do the things they want to do. They may be counter to the social or medical or just the health of the general populace, right? It's a citizen where advantages are taken.
It's absolutely crazy. Even the cost of simple medications, I was looking up there while we're looking at this. It compared to the rest, you're paying 10 times more per pill than anywhere else in the world for the same medications.
Right. Well, there's ones that come from Ireland, go to the United States, and get sent back to Ireland, right? And they're cheaper after having crossed the ocean twice, right?
Yes,
it's insane.
10 times cheaper actually in some cases.
Weird, right?
There's certain medications I'm on that are manufactured in Ireland, and the same medication in the United States is literally 10 times the price.
I got a little sidebar for
exactly
you.
The same.
Yeah, I got a little sidebar for you. Remember we were talking about Ozempic, right? And I was looking into it. So before Ozempic became a really big thing, it seemed like society was headed toward you should probably accept people if they're a bit heavier, and being big is beautiful. But as soon as Ozempic hit the market and it was huge, all that went away. All the folks that were up in there in the social class, as far as Hollywood and stuff like that, all of a sudden they all got really skinny. And then the beauty standards changed. Weird, strange, I don't know.
Yeah.
Makes one go, I don't really understand how that happened.
Exactly.
You know how the hell that happened.
Yeah.
All right, here we go.
Ossoff also highlighted the work of KFF, a nonprofit that's focused on health policy research. And actually, in one of its latest polls, it found that prior authorizations rank as the public's biggest burden when getting healthcare. And you also had insured people reporting a whole bunch of other issues now.
So do you know what that is, a prior authorization?
It's a strange, it's the first time I've heard that term, actually.
So let's say I go to the doctor, I'm like, hey, doc, my this and that hurts because like this.
Yes,
and the doctor's like, well, I've diagnosed you with this. Your treatment plan is this. So then I have to get a prior authorization from the insurance company that isn't a medical doctor to say, yes, I approve of it, Without a prior authorization in the United States, generally speaking, you will not get a procedure. Well, unless you're
Wow.
like the military or something like that, where the doctor says, I diagnose this, the treatment plan is this, there is no prior authorization if you're active duty military in the United States service, right? You just, the
Right.
doctor says treatment plan, and then they hit you. Like
Okay.
diagnosis, treatment plan, we get on the treatment plan. That's it,
Wow.
right?
Everything is just so, I'm going to put it, everything is just there to block people from accessing healthcare.
Right.
That's the way I,
Yeah, everything is an
It's-
obstacle. And when he says the prior authorization is the most difficult thing, it is. Because you have an insurance company who says, I don't care what the diagnosis from the doctor is, we're not approving your treatment plan. Then you have to go back to the doctor and get another series of appointments. And I guarantee you it's not just one. It's not just one. It's going to be multiple. I had an injury and I was told that I cannot get surgery unless I do 5 or 6 other steps. And I said,
Wow.
look, the problem requires surgical intervention. Something is torn. There's no amount of physical therapy that's going to reattach muscle to muscle or muscle to bone. It's not happening. So I need the surgery. I had to wait 14 months for a surgery I should have gotten within 6 to 8 weeks, which cost
Wow.
me all kinds of things. One of them was my ability to have a different kind of
But-
job than this one. This is
Wow.
what I can do, which is why I
This
do
is a-
this.
well, the procedures are way different over here. You go to your local GP, they'll refer you to the local hospital, then they'll check you out. You go on a list, and then you get your appointment, and that's it. It's pretty straightforward, really.
Right. But
Well, if you're with insurance as well, you just get the letter and you send from the hospital, you send to your insurance company, and everything gets ironed out very
Right.
quickly.
So what it looks like a lot of times is between your diagnosis and your prior authorization, it's like trying to get over Mount Everest. And then what they'll do is the doctor's then going to have to come up with a different kind of treatment plan for your diagnosed issue, even though it's understood the treatment for X issue you have is Y treatment plan. You need to go like in steps, 1, 2, 3, get the thing.
Wow.
But with all the requirements for prior authorization, that's it's a massive backlog, and it is horrific to try and navigate those waters. I'm not a doctor. I don't know. But the doctor said, my treatment plan is this for the diagnosed issue. But you're the insurance company. You're not a medical doctor. Why are you making the determination? It almost has to be a financial burden on them to perform the task, right? Because they're going to be held liable for a big portion of that because they're the insurance company who's supposed to be paying for the thing. It's why I have health insurance, right?
Yeah.
Right. And
Wow.
it wasn't until my doesn't matter, mid 40s when I needed a little more to go to the doctors and that kind of stuff, right? But for 25 years, 27 years, I paid into a system that I got not much out of, right? But now I needed a little bit more, and now I'm getting prior authorization issues, just like he's talking about, right? The doctor says, hey there, Mr. Johansson, check it out. Here's your treatment plan for the diagnosed thing. We're going to have to send in for a pre-authorization. I'm like, why is that even a thing? Right? And I get there has to be a check and balance, right? But it seems like the check and balance isn't for the betterment of society's health as a whole. That's all.
Wow. It's crazy.
Mm-hmm.
Absolutely crazy.
I applaud DeFranco on that. Funny. That's funny. Look at that. That's cute. All right, here we go.
Getting the healthcare system with their biggest economic concern being the cost of healthcare. For today, we're going to stick with prior authorizations because this is overlooked. You see, about a third of insured adults in the US, they say that they find prior authorizations as a major burden to getting healthcare. And another almost 40% found it to be at least a minor burden. So that means that around 70% of people find the process burdensome in some way. That's more than the percentage of people who reported issues with understanding bills or what's owed, getting needed appointments, or finding providers who accept their insurance. Also, around 40% of insured adults with a chronic condition say prior authorizations are the single biggest burden when it comes to getting healthcare. And that's a big number and group we got to focus on because these are likely people who are interacting with the healthcare system, including health insurance companies, more frequently. But also, either way, whatever group you single out, this seems to be the case, right? People with employer-sponsored insurance, people who purchase their own insurance, people on Medicaid, Democrats, Republicans, independents. For all of them, the most common answer to the question, what is the single biggest burden when it comes to getting healthcare, was prior authorization. And that may be because during the prior authorization process, some treatments or medications recommended by a provider may get delayed if the insurance company doesn't just outright deny coverage.
And denial happens a lot. So what happens is you'll have your doctor put in for the prior authorization. It'll come back with a no, a denial, and then they refile it, and then it's a no, and then they refile it a third time, and finally the insurance company's like, oh my God, yeah.
Of course, that costs the patient time.
Oh, for sure.
And by the time they get the procedure done, it's probably worse than it was at the beginning.
Right. And it might make it so that that procedure isn't the procedure that's involved in
Wow.
the current diagnosis, right? Now the
But then they
treatment
would
plan
have to
has
come
to
back
change.
Oh, wow.
Right. So I had that problem with the thing where I had to wait and wait and wait, and I developed other issues, right?
Okay.
So
But it's absolutely mind-boggling how backward the system is over there compared to Europe, even.
yeah, it's not the best. And I have a lot more to say about this, but I want to wrap this thing up, so we'll get through this first portion of this. But yeah, it's definitely a broken system. So here we go.
But according to this poll, a whole third of insured adults say they've had a health insurance company deny coverage for a certain healthcare service treatment or medication prescribed by their doctor in the past 2 years. And some of those who may have to deal with this over and over again are the roughly 35 million people that are enrolled in what's known as Medicare Advantage plans. And
Also, there's a medication issue involved here as well. So there's a trials period. There's a period when medications come out and you can use them. But for a certain period of time, you cannot use a generic version of a medication. You can only use the name brand. And doctors are like, well, this is the best thing. This specifically solves the problem. But if there isn't a
Wow.
generic if there isn't a generic prescription possible, a lot of times you cannot get the prescription. You have to get a pre-authorization to get a certain kind of medication approved. And then they just say, no, you can't have that. And then as opposed to using the most effective medication, you have to try and get a cocktail of other medications that are already on the market that they can actually prescribe you. Right?
Wow.
Yeah, it's wild. And
Oh.
again, it costs 10 times as much. And the 10 times as much is filler for the federal government to pay to the pharma companies, a lot of them run by the insurance companies. It's a
My
massive
God.
Ponzi scheme that is literally just ripping the citizens of our country's tax dollars to go pay for and fund this thing. Right?
And wasn't that one of the key points that Trump got elected on was fixing the healthcare system, wasn't it?
Yes, and the thing that he just passed, we talked about a little bit earlier, by redefining, and as of October 1st, there being a very clearly delineated line between who gets it and who doesn't, the lawfully present term is removed. So it removes that ambiguity. So that means that we will now know, based specifically on your status, if you are due or not due healthcare. Not we don't know, right?
But what I'm saying is, what is he going to address the insurance companies and the way they manage this whole situation?
Well, that's why that senator that DeFranco was talking about, who is on the opposition side from the current sitting administration, as well as Congress, both the Senate and the House of Representatives, he should be able to get a bipartisan bill put forward that should do something about this, because this is a concern for all constituents in all jurisdictions in the United States.
But
Right?
if he gets
All of
something
us.
done, if he gets something done before the midterms, it'd be a massive boost to the Republican Party if they can solve this particular issue.
Well, if they can at least show a good foot, right? Hey, we're
Yeah.
going to do the best we can. We're actually concerned about this process, although it looks like we're burning money in other avenues that we shouldn't. And we won't talk about those avenues, but we know what they are.
Yes.
Here we go.
actually, just to explain here, Medicare is a federal health insurance program primarily for people aged 65 or older, as well as younger individuals with certain disabilities. And Medicare Advantage is a Medicare-approved alternative offered by private insurance companies. And almost everyone enrolled in this type of plan is required to obtain prior authorization for some services, especially higher cost services, things like inpatient hospital stays, skilled nursing facility stays, and chemotherapy. With KFF finding that Medicare Advantage insurers made nearly 53 million prior authorization determinations in 2024, more than 4 million of which were fully or partially denied. And then with those denials, very notably, only around 11% appealed.
So if you get a prior authorization denied multiple times, but eventually get it approved, then it's considered an approved request. So those numbers are fudged big time. Big time. That was some bullshit stats right there. That's craptastic, bro. That's not cool.
Makes you wonder, well, how many people were just left without coverage simply because the appeals process was too difficult? And so in this letter, you would also argue it.
By the way, bear in mind, a lot of those figures come from the insurance company themselves.
What? You don't think their self-reporting is going to be honest?
Yeah, I just bear that in mind. To be fair to Philip DeFranco here, a lot of these figures are reported by the insurance companies, so they're going to be all over the place. So overall, if 1/3 of Americans have got denied, so that is a crazy number to begin with. Absolutely crazy.
53 million is about 1 in 7. But I believe you're impugning the character of those insurance companies, sir.
well, let's face it. From a European point of view, looking at this health service, it's an absolute money mill
It
for the
really
insurance
is.
companies.
And if
Yeah.
the shoe fits, right? It might be. All right, here we go.
Far easier for insurance companies to deny services than for patients to navigate this burdensome process. And that's especially a problem because
The punishment is the process. It sucks, for sure.
Yes.
at least those Medicare Advantage denials, they were fully or partially overturned in more than 80% of appeals. And so with KFF writing, these requests represent medical care that was ordered by a healthcare provider and ultimately deemed necessary, but was potentially delayed because of the additional step of appealing the initial prior authorization decision. Such delays may have negative effects on a patient's health, which, yeah, you don't say. And to be clear, there is evidence to back up that claim. A study from Johns Hopkins University earlier this year, for example, found that authorization requirements were associated with disease exacerbation, preventable hospitalization, prolonged hospital stay, and lower rates of disease-free survival.
And understand that the people who are getting these services are the ones who need it the most. That's why they're on the Medicare. That's why they're where they are, right?
Yeah. It's absolutely unbelievable to see this.
Yeah,
Like,
pretty much.
like the USA is one of the richest countries in the world.
I would agree with that, yeah.
By all stats, Trump just keeps saying it every 5 minutes just to make sure that we don't know it. One of the richest countries in the world has this type of healthcare system.
But again, that's because bureaucratically and with lobbyists and things like that, you can bend the rules. And with government officials going into and out of the private sector jobs in the space where they were regulators prior, gives them a lot of clout. And they can just navigate the waters and say, nah, we're just going to do it like this. And then they get back into the government job and they're like, I'm just going to do the thing that helps out the widget lobby or the insurance lobby or whatever it is, right? So
like it's crazy when they're up to recently, millions of Americans were crossing the border to Canada to pick up basic medications like insulin and so on. It's shot, as I say, getting back to the point of you're one of the richest countries in the world, and this is the healthcare system you have for your citizens. This is the best you come up with.
I think it's good, except that there's a money mill, like you were saying, where the dollars are just going directly from the federal government to the boards of these large insurance companies.
Yes.
Not great. Here we go.
Survey from the American Medical Association, physicians deal with an average of 39 prior authorizations every week, requiring 13 hours of work. And 93% of them also reported that prior authorization delays necessary care, and 82% said that it results in patients abandoning necessary services. And also a big thing to note here is this is an issue that policymakers have long been aware of. In fact,
abandoning necessary procedures. Necessary.
Yeah.
Like that's very interesting phrasing. They need the thing. And because it is arduous to go through the gauntlet, they're like, I'm just not doing it. I'll live with whatever this issue is because I don't want to mess with the paperwork. I'm over it.
Yeah, now, as I keep going back to the point is, if Trump can solve this the Republicans would run away with the midterm.
Oh, well, they might even build a statue for him too. You know?
But I can guarantee you, and I'll even put a bet on it right now, from now to the end of his term, he might maybe do a token gesture, but because of the insurance lobbyists, that'll be it. Because there's just too much money being paid out into the system.
Right, but he's already constrained them as of 1 October, so there's going to be a massive shift in that anyway.
By the way, he tightened up the language of the law, but not the underlying problem of what's going on in the Medicare system.
Seems a little fraudy. All right, here we go.
2024 federal regulation required certain insurers to publicly report certain metrics related to prior authorization requests. And the deadline for the first set of data covering 2025 was March 31st, 2026. And you've since had KFF getting into and claiming the data actually offers little insight into who gets approved or denied, saying there's no consistent way to find the data on insurers' websites and saying it's not broken down in ways that are actually useful. And then there are also similar concerns about companies finding around whatever gets thrown at them next.
So the thing with that is you can set that data up however.
Yeah, you're asking the insurance company pretty much the pinky promise or telling the truth.
Yeah, so what they're saying is that you have to tell on yourself. You better tell on yourself. They're like, no, we ain't doing that. No. Hell with that.
No, what they do is they get this big brown envelope and put it in somebody's pocket. And it'll all be ironed out in the end.
I did not break the cookie jar. It wasn't me. No.
Yes.
You have a cookie in your hand.
Yeah,
It wasn't me.
and
The
you
cookie's in
turn
your
around and
hand.
give the guy 10 euros, and he'll guarantee you he'll back you up saying you did break the cookie jar.
No. All it took was a lobbyist and $10, right? Or $1 billion. All right, here we go.
Like last summer, for example, you actually had the Trump administration announcing that dozens of health insurers had signed a pledge to reform prior authorization, vowing to limit the types of claims that require pre-approval, lower wait times, and
They pinky promised. They said they would.
Pinky promised to fix the system. There we go.
Right. Oof. I think it'll work out well. I think.
No, yeah, of course it will.
Maybe.
Sorry. Patients when denying a request. But patients, advocates, and providers, they've all expressed doubt that companies will effectively follow through on their promises. Now, that said, bipartisan legislation has also been introduced in both the House and Senate. And actually, just last week, CMS released a proposed rule that would apparently aim to streamline the process of getting prior authorization for prescription drugs. And
that's a really important one. The prescription drug thing has to do a lot with generic versus named brand medication. Medication we know works, but we can't prescribe because prior authorization will disallow the prescription.
Then also,
it's crazy
action at the state level, with at least half of all state legislatures taking up bills related to prior authorization just this year. Right, a lawmaker in Minnesota, for example, brought forward a bill to ban the use of artificial intelligence for making denial decisions on prior authorizations. And then the governor of West Virginia, he actually signed a bill passed unanimously by the state legislature last month. And what that one would do is let people with a plan from the state's Public Employees Insurance Agency who have been approved for a course of treatment to pursue an alternative medically appropriate treatment of equal or lesser value without the need of another prior authorization. And if that long sentence, it sounds...
That's perfect. So if you get approved for X amount of dollars for a treatment plan based on your diagnoses, if there is another set of treatment plans that functions for your diagnosis, without another prior authorization, you can just switch it, right? And that's pretty good.
That makes sense.
Right. And not only that, go ahead.
That's common sense. Why did he put that into the big, beautiful bill?
I think that would have been overreach and the Democrats would have shot it down. But that's the machinations of the legislative
No,
branch.
wait a minute a second. That was a Democratic guy who just suggested that law.
Yeah, and it went through and it was good.
Yeah.
So, but I think it's overreach as far as not at the state level, but at the federal level.
Extremely specific. That's for a reason. Right? That law came into effect after a man by the name of Eric Tennant died following a long battle not just with cancer, but with his health insurer over whether or not the treatment recommended by his doctor would be covered. With his insurer, Public Employees Insurance Agency, repeatedly denying him coverage of a non-invasive cancer treatment that would have used ultrasound waves to target and maybe shrink the largest tumor in his liver. And while his family, they didn't expect the procedure to totally get rid of the cancer, they reportedly hoped that it would give him a little more time and ease his pain. But the insurer, they said that the procedure was not medically necessary and that it was considered experimental and investigational. And while the
What's funny about that is they say that about a lot of those. And a lot of that is AI determined. I don't have people, so I'm not paying people to perform a task. And the humanity is completely taken out of it, right? If you or I see someone who has options and we're like, no, that's a really good option, but it's investigative or it's exploratory. No, let him do the thing. Like, if you can save the man's life.
I think they're just blaming AI there, but at the end of the day, insurance companies are there to make money.
Yep.
And the sad thing is, it's American patients, U.S. citizens who pay the price at the end of the day.
Yeah, they die.
If they're not reined.
Yeah.
If the insurance companies are not reined in at some either state or federal level, these tragic stories are going to continue to happen all across the United States. No matter who you vote for, this 100%. Is going to continue to happen.
Sure, eventually switched its decision, notably after Eric's case was reported on by KFF and NBC. By then, it was too late. Within 1 week of that reversal in late May, he was hospitalized. His health had just kept getting worse, and by the middle of the summer, he was no longer considered a suitable candidate for the procedure, and he died a short time later. So with that heartbreaking story just being one of God knows how many, and the whole situation just being so infuriating and ridiculous, we needed to hear from John Ossoff directly, and that's exactly what we're going to do right after this quick break. Do you ever send an email and then you get ads about it like 5 minutes later?
Yeah, I do. Tell me more.
Because that's not a coincidence. And this is specifically about your email, not your browsing, not your apps, your inbox.
Oh, my email, you say?
Because most email services, they're not just delivering your emails, they're scanning them. And
that's dirty. They're scanning my emails? I can't believe it.
Today's sponsor,
big tech companies being like that.
Proton Mail was built by scientists in Switzerland with one goal: make privacy the default, not the upgrade. Instead of your data
and make money. Don't forget, make money.
With zero access encryption, meaning only you and your recipient can read them. Yeah.
Targeted ads. Yeah. So, as an aside, they're not our sponsor or anything, but we use Proton Mail for its security aspects.
Actually, Proton Mail, yes.
Yeah. And when we have to send bigger files and stuff like that, we pay a nominal fee per month. It's super cheap. We got a lot of storage space. And honestly, it's awesome. It's just an awesome product. I saw that ad in there. I was like, we're going to cut the ad. And I'm like, but wait, no, we use that too. Like, I don't
We
mind-
actually use that. We actually use that service. So yeah, leave that in.
Well, I'll pimp that product for sure. Like it does what it says it's going to do.
And by the way, don't forget to support Philip DeFranco's Proton.
Right. Do the thing for Philip DeFranco. We're going to go ahead and drop his episode in there so you guys can access it if you want to get it right
Watch the
from
full episode. As well worth it because he's actually.
Yes.
I personally like Philip DeFranco. I know a lot of people don't particularly like him, but I think he's pretty balanced in a lot of ways.
Well, Jillian Michaels and Philip DeFranco today, like amazing work. They did very, very well, and I'm just honored that we could, come behind and review it and put our 2 cents in. So
exactly, I think it gave everyone a lot of food for thought, especially when it comes to medical services in general across the United States. It's, as I say, it's shocking to see how poorly run or poorly managed the entire health service is across the board.
Right, but if it's a money mill, then that's the function of it, right? The bureaucracy is going to attempt to secure its own monies, and then it's going to attempt to put it in the places where it's been funneled to go.
It's shocking to see how much is being pumped into the system with such poor outcomes afterwards for patients and so on.
Kind of like our education system. All right, anything more for the good of the people, Patrick?
No, that's it. We kind of left on a nice cheerful note there, as they would say.
I like it.
Sponsorship. Well, Philip DeFranco's sponsorship of Proton Mail.
Yes. All right, everybody.
Hopefully, we will get sponsored by them one of these days. You never know.
That would be great. That would be great. But we're not begging. Our hats are out, but we're not begging. All right. For Patrick McCallum, I am Alex Johansson. Like, subscribe, ring the bell, do all the things. Help us beat the algorithm. We're the A&P Gents, and we are out.